Can you turn me on? Yeah, thanks, Ben. So Dr. Condren's on his way up. He's our final speaker. Just your name tags that you have around your neck, if each of you could please drop them off on the registration table before you leave. We like to recycle those. Tonight's banquet, just as a reminder, starts at 6 o'clock. And Dr. Condren, I'm just going to give a little brief bio on him. So he received his medical degree in 1977 from Hahnemann Medical College in Philadelphia, completed his residency in ophthalmology at the Shea Eye Institute in Philadelphia, Pennsylvania, at St. Francis General Hospital in Pittsburgh. He became board certified in ophthalmology in 1981. And he's here. We tried to bring him in during the pandemic, but we couldn't meet during the pandemic, and he was going to talk to us a little bit at that time about how he went from no surgery to surgery. And so anyway, he's going to talk with us a little bit today about humanitarianism. Thank you.
Thank you, Jean. This meeting has really been inspirational for me. All of the talks have been phenomenal. And you know, I just feel so much love in this room, and I'm so happy to be part of the COS community. And I'm really excited to be up here on this stage to share with you, I think, some information that may help you in your personal life and also maybe even in your practice. So I have no financial interest. And my purpose here is to help you bring spirituality back into ophthalmology, maybe in a different way, and introduce you to a new tool that may be able to help our patients. I'd like to begin by showing 2 short video clips.
Are you unable to enjoy summer because of your seasonal allergies? You aren't alone. Many of us suffer the coughing and sneezing that makes spring and summer feel gloomy. But now, you can enjoy the outdoors with antihistamine syndrome, bankruptcy, back problems, gout, temporary blindness, heart failure, dyslexia, total shutdown of vital organs. Are you unable to enjoy summer because of your seasonal allergies?
We spent a half hour break to get everything worked out. Maybe you could just play the video number 1 and number 2.
Are you unable to enjoy summer because of your seasonal allergies? You aren't alone. Many of us suffer the coughing and sneezing that makes spring and summer feel gloomy. But now, you can enjoy the outdoors with antihistamine.
The lows of bipolar depression can leave you down and in the dark. But what if you could begin to see the signs of hope?
Dyslexia, total shutdown of vital organs. Do not consume milk or water while taking
the lows of
People who take antihistamine are likely to develop certain cancers, as well as worsening and even new allergies. Other side effects include paralysis, neurocorrosion, seizures, AIDS, lung drowning, kidney failure, testicle erosion.
Next video, please.
The lows of bipolar depression can leave you down and in the dark. But what if you could begin to see the signs of hope all around you? What if you could let in the light? Discover Caplyta. Caplyta is a once-daily pill proven to deliver significant relief from bipolar depression. Unlike some medicines that only treat bipolar 1, Caplyta treats both bipolar 1 and bipolar 2 depression. And in clinical trials, feelings of inner restlessness and weight gain were not common.
Caplyta can cause serious side effects. Call your doctor about sudden mood changes, behaviors, or suicidal thoughts right away. Antidepressants may increase these risks in young adults. Elderly dementia patients have increased risk of death or stroke. Report fever, stiff muscles, or confusion, which may be life-threatening, or uncontrollable muscle movements, which may be permanent. These aren't all the serious side effects.
In the darkness of bipolar 1 and 2 depression, Caplyta can help you let in the light. Ask your doctor about Caplyta from Intracellular Therapies.
So let me ask you something. Are drugs really helping our society? And these commercials really disgust me. In fact, the US, we're the only country where we have commercials like this. In Europe, they don't have anything like this. And I really think these commercials are pushing us to become more dependent on pharmaceuticals. And I think these are false idols. And most drugs maintain disease. There's no attempt to cure. If you have high blood pressure, the doctor doesn't say, hey, take this medication, we're going to cure it. They're maintaining diseases. We're maintaining chronic disease. And we're also doing that with our glaucoma patients. Are we curing glaucoma? We're maintaining it. I want to ask you if there's a better way. But let's go back. I think medicine used to be based on scientific observation. I make an observation in my practice. Patient comes to me, Doc Conrad, I ate 8 carrots and my vision was better. I go, interesting. Somebody else comes in with bad vision. I say, hey, why don't you try 8 carrots? We didn't wait for clinical studies, national studies, placebo control. Medicine was also based on a case report. I may tell you some information, and you may say that's interesting, and you go back in your practice and try it. That's the case report. And there's also something called experience and knowledge. A recent testing. Does this work? There's experience versus knowledge. You know, when I graduated from my ophthalmology program, I thought I had all the answers. I felt that there wasn't any disease that I couldn't treat surgically. So I want to talk a little bit about a study that was published in the British Journal of Ophthalmology, evidence-based medicine. And it really irritates me when doctors say, I practice evidence-based medicine. Well, a study was done to show that 23% of evidence-based articles that are quoted are going to be refuted in the future. We don't know what 23% that is, but they're going to be refuted. Clinical experience is probably more important than any evidence-based study. You may read that the femto laser is much better than, you give better results for phaco, but if you don't have one and you do a good can opener or circular tear, that works better in your hand. And when anybody asks me advice, Dr. Conrad, what should I tell my cataract surgeon to do? I say, well, you let him do the best procedure that's comfortable for you. Forget about what you read on Google or any evidence-based article. Also, we have patients' values to take into consideration. They may not want an injection. They may want not a blood transfusion, etc. So what is disease? You know, the Christian Judeo religion teaches us that we are made in the likeness of God. And if we are made in the likeness of God, disease should be an intelligent response in our body. If we have a disharmony, maybe disease is essential for us to maintain homeostasis. I also believe that disease is a delusion and it's a separation from God. And that's one thing that's very joyous being here. You understand that if we do have a connection with the Lord and we have that, we'll have better harmony in our life and our bodies will be much healthier. Now, in 1991, I was on top of my game. I made the cover of Ophthalmology Times for doing cataract surgery with odd sutures. You know, at that time we were doing phaco, but you had to enlarge the incision to 6 millimeters to put the lens in, and you still had to use sutures. And I'm thinking, why in the world, what advantages does it have over extra cap? So I began doing a tunnel approach and not using sutures. And I almost lost my hospital privileges. Dr. Conrad, you have to use sutures. This is malpractice. So I did a study that was presented at Asterisk on the rupturing pressure of sutureless cataract surgery versus sutured. And believe it or not, the sutureless surgery had a higher rupturing pressure. Everything was going fine, but the Lord had a different path for me. I developed severe adult onset asthma, and I was required to take 3 medications in order to control my breathing. And you want to know what asthma is like? Get a soda straw, hold it in your mouth, and try to function breathing through that soda straw. That's what it was like. Now, these 3 medications helped me, but one of the side effects was a bad tremor. And you can't be a good cataract surgeon with a tremor. Mr. Smith, I think you need cataract surgery and your hand shaking. So I had to take Theodore, which is a beta, not Theodore, a beta blocker, I forget the name of it, to get rid of my tremor so I could do surgery, but my asthma came back. And I was a mess, and I said, you know, God, I want my old lungs back. There has to be a way. I went to all the top pulmonary doctors, and they told me the same thing. There's no cure for adult onset asthma. Make sure you take your medication. So at that time, I was doing a lot of marathon running and doing triathlons, and I was taking homeopathic remedies, and I thought, well, maybe homeopathy could help me. I did some research. So I went to a homeopathic doctor, and if there's going to be a placebo effect, it should have helped me right then. And I took the first remedy, homeopathic remedy, didn't do a thing. I went back, took a second homeopathic remedy, not much. Third homeopathic remedy, it was like somebody turned on a light switch. I could breathe again. And my mental and emotional state changed. I said, my goodness, this is amazing. Homeopathy saved my life. Now at that time, like many of you are thinking, homeopathy, it's a bunch of crap. People study homeopathy because they're not smart enough to get into medical school. That's what I thought. So I went to a homeopathic lecture, and I'm sitting in the back of the room, quiet, didn't want them to let them know that I was a medical doctor. And sitting next to me was this guy named Carl Robinson. We struck up a conversation, and as it turned out, Carl, a brilliant medical doctor, a graduate of Yale, he practiced medicine for about 10 years, became disillusioned, and investigated all forms of healing, and he decided homeopathy was for him. And he wrote a book called Small Doses, Big Results. The American Institute of Homeopathy was founded far before the AMA. In fact, the AMA was founded mainly to fight the homeopaths because they were getting really good results. The American Institute of Homeopathy has a very large homeopathic research database which shows the validity of homeopathy. And there are a lot of misconceptions about homeopathy. It's not vitamin therapy, it's not nutrition, it's not herbal medicine, it's not psychotherapy. Homeopathy, I believe, brings spirituality into medicine, and it's based on true laws of healing. A true law of healing doesn't change over time. And the homeopathic principles are the same principles we used 250 years ago. And homeopathy attempts to cure disease. Homeopathy cured my asthma, it didn't maintain it. And it's a unique approach to healing, respecting the body, treating the spiritual, mental, emotional, and physical aspects. Homeopathy is very popular in India. They say that if you throw a stone into a crowd of people in India, you'll hit 10 homeopathic doctors. And I had the pleasure of studying with Dr. Jugal Kishore in New Delhi, and it just blew my mind. I mean, his waiting room had hundreds of people waiting for him, and he was this old man. He would take the homeopathic case. People came in with these chronic diseases, hundreds of them, And he would be curing all of them. I couldn't take notes fast enough, trying to understand, this whole homeopathic method. Homeopathy, as you know, is very popular in England. The royal family practices homeopathy. My wife and I just got back from France, and every pharmacy in France has tons of homeopathic remedies. Same thing with Germany. Homeopathy respects the body. Western allopathy disrespects the body. And Big Pharma totally disrespects the body. So the idea of homeostasis. So if you have a fever, the traditional doctors say the fever's bad for you. You got to take something to cool your body temperature. Homeopathic doctor says, well, if your body has an intelligence, your body needs a fever. So let me give you a medication which causes a fever. If you have diarrhea, traditional doctors will give you something that causes constipation. The homeopathic doctor will give you something which actually causes diarrhea. You may say, this is crazy. Well, my asthma was cured by a homeopathic remedy that causes asthma. So I became convinced that I got to look at homeopathy. Maybe it could help my eye patients. So I went to study homeopathy at the Hahnemann Homeopathic College, which is kind of ironic because I graduated from the Hahnemann Medical School in Philadelphia, and I went again to study homeopathy in California. It was a 4-year program, one long weekend a month for 4 years, and I loved it. I loved it. When I graduated, I was offered a position at the American Medical College of Homeopathy, and essentially at that time, I abandoned my surgical practice. I said, I am going to dedicate my practice to alternative treatments I felt that could really help my patients. I have another video. I hope this can play. This would be video number 3.
I use homeopathy because of the science and research behind it. Homeopathy stood out for me because it worked with my inner capacity for healing. I turned to homeopathy after other forms of treatment did not work for my chronic conditions. Homeopathy has a proven track record for success, but it may not be for everyone. Common side effects include a greater sense of health and well-being and a deeper connection to family and friends. In many cases, physical and emotional symptoms may disappear completely. The most common side effects include a feeling of comfort and mental clarity. Anxious and depressed patients may experience renewed feelings of joy and a reconnection to life. Homeopathic patients often experience improved focus and memory. Men, as well as women of childbearing age, may experience greater sexual enjoyment. Call your doctor if, after starting homeopathic treatment, you feel an increased sense of energy, physical stamina, and generalized happiness, as these could become permanent. Other risk factors may include the complete elimination of pain, stiffness, and discomfort in the body, as well as improved judgment and motor coordination skills. In studies, these improvements often last a lifetime. Drinking alcohol will not affect the action of homeopathic remedies. Do not use homeopathy if improved health and vitality are not of interest to you. Before using homeopathy, please speak with your doctor about what life might be like without a general feeling of lethargy, boredom, and malaise. Talk to your doctor, since the complete elimination of symptoms may make regular doctor visits unnecessary. Ask your doctor if the safe, natural, effective, and complete elimination of your mind and body symptoms is right for you. Ask your doctor about homeopathy.
So I guess the question is homeopathy, does it resonate with Christianity? And there are 2 books that were written, Homeopathy and Early Christianity, and A Christian's Guide to Homeopathy. And both of these books seems to agree that there's structural similarities between the Christian religion and homeopathic medicine. And it's not uncommon, really, that you can see healing bordering on miracles. I have a question for you. Who was the first homeopath? Anybody know? Jesus? Actually, it was before Jesus. It was Moses. Exodus 32:20. And he took the calf which they had made and burnt it in the fire and ground it into powder and stewed it upon the water and made the children of Israel drink it. This is how we make our homeopathic remedies. We grind it, we burn it, we put it into powder, we put it in water, dilute it, and make you drink it. It's interesting, Moses had the right technique for making the homeopathic remedy, and he also selected the right remedy. The calf was made of gold, and gold is a homeopathic remedy for depression and despair. So the children of Israel at that time had depression and despair. He got the right remedy. But actually, the true developer of homeopathy was Samuel Hahnemann, brilliant man, fluent in 6 languages, chemistry and medicine, and he protested the medicine of his time. And he developed homeopathy while he was translating Materia Medica. It stated that the Peruvian bark, or cinchona, was good treatment for malaria because of its astringent qualities. And he said, this doesn't make sense. Why is something astringent good to treat malaria? He began taking small doses of the cinchona bark, and he developed malaria symptoms. And he said, aha, this is the law of similars. The law of similars state a substance which causes disease in a healthy individual will cure that in a diseased state. So we're all familiar with belladonna. Belladonna is a substance, if you take it in a toxic dose, you'll develop redness, a fever, you'll become delirious. But in a belladonna state, if someone has a fever, they're delirious and redness and an elevated temperature, belladonna will treat that. So Hahnemann proved over 100 different homeopathic remedies over his time, and he published this in the Materia Medica Pura. Now, there is a European Council of Homeopathy, and to do a homeopathic proving is very, very extensive. And the homeopathic provings are done in large groups. They study the results, they're tabulated, and there's volume. So in homeopathy, we're looking at symptoms. In traditional medicine, when somebody takes a medication and they develop a side effect, in homeopathy, they don't call it a side effect. They call it the way an individual reacts to that medicine. So let me just go here. But this is an example here. This is an example of 3 different homeopathic remedies. Allium cepa, or the onion. If you're peeling an onion, you're a healthy individual and you peel an onion, your eyes are going to water. So homeopathic allium cepa is good for watery eyes. Get stung by a bumblebee, you're going to get redness, swelling, and edema. Homeopathic apis mellifica is good for swelling and edema. A rattlesnake bite causes intravascular hemorrhage, and our snake remedies are wonderful for retinal hemorrhages and hemorrhages in the body. Now, there are a lot of homeopathic-like therapies in conventional medicine, modern allergy treatment. If I'm allergic to ragweed and I go to the allergist, what does he do? He gives me injections of ragweed. And I go, hey, doc, I'm allergic to that stuff. Why are you giving it to me? Immunizations, in a way, is kind of like a homeopathic. Radiation therapy, or radiation causes cancer, but at the same time, radiation is used to treat cancer. Digitalis, in low doses, treats heart failure, but in high doses, it causes heart failure. Ritalin is used to treat hyperactive children. The other thing, and I don't want to spend too much time on this, is Hering's law of cure, that the body heals in a certain direction. When we give the right homeopathic remedy, we like to see an improvement of the mental emotional state than the physical. All of this is integrated in the healing process, the mental, the emotional, and the physical. But typically, the mental and emotional have a much higher realm than the physical. We want to see changes in that. So you may be asking, why are you talking about all this? What does this have to do with ophthalmology? How can it help me in my practice? Well, this blew my mind. In the late 1800s and early 1900s, many ophthalmologists were homeopathic doctors. Can you believe that? New York Ophthalmic Hospital was under homeopathic management. And there were many homeopathic journals. And when I did my homeopathic training, I went to the library in San Francisco, and they had all the original journals, and I couldn't believe it. I was looking, I read through every journal article, copied many of them. I couldn't believe it. These homeopaths were treating endophthalmitis with homeopathic remedies. I mean, this was before antibiotics. They were treating cataracts. There was information after information. It just blew my mind. And these are some standard textbooks on ophthalmology and homeopathy, and I have all these books in my collection. One of my favorite books, you may want to jot this down, is called Copeland's Cure. Royal Copeland was an ophthalmologist in the early 1900s. He was a very, very proficient surgeon. In fact, he was one of the first surgeons to do a corneal transplant, if you look at the data. And he loved homeopathy. He used homeopathy on all his patients. And in this book, it's just amazing. He talks about the cures, the miracles in his practice due to homeopathy. And Copeland, in summary, said, homeopathy should be good in preparation for surgery, help the patient's mental and emotional state to help them get better results, good for post-op recovery, and as an alternative to surgery. And mainly, and the bottom one should be underscored, to treat problems that present treatments are not helping. And how many times we see patients in that situation. I got a call the other day from a patient, one-eyed patient, who had cataract surgery. During the cataract surgery, complications, he developed a choroidal infusion. They had to drain the choroidal infusion. Now he has a silicone oil bubble in the eye, and he's scared to death. And he wants me to help him. And I know that homeopathy can help him on some level. And I get calls all the time like this. End-stage glaucoma patients that are going blind. And they're taking all their medications. They're having side effects. I know that homeopathy can help. Now, one of the big secrets that plastic surgeons use is homeopathic arnica. How many here have heard of arnica, homeopathic arnica? If you're an athlete, you exercise and do running, arnica is just amazing to get rid of musculoskeletal problems. In fact, a lot of people first are introduced to homeopathy through arnica, and that's how I got an interest in homeopathy when I was doing marathons and triathlons. Now I want to present a case to you which really changed my opinion, because after I graduated from my homeopathic school, I was slowly introducing it into my practice. And a 57-year-old radiologist presented to me, and he was from New Orleans, and he was lecturing at the University of Pittsburgh, and he developed sudden loss of vision in his left eye. And he was evaluated at the retinal service, and they diagnosed the central retinal artery occlusion. Now, he was from India, and as I mentioned, in India, homeopathy is very popular. And he heard that I was this ophthalmologist doing homeopathy. And he came to me, and this is 5 days after the retinal artery occlusion. I did my physical exam on him, and I proceeded to do my homeopathic evaluation. Now, the homeopathic evaluation is unique because essentially we're treating the person, not the disease. So I just had a conversation with him like you would with a friend. And I found out that the interesting thing about him, he likes to argue. I says, oh, tell me more about that. He says, Dr. Conrad, I love to argue. Even if I know I'm wrong, I'll argue and just wear the other person down. Maybe this is kind of natural for a lot of Indians because you don't want to get into an argument with an Indian. So anyway, I thought that was kind of interesting. So he's very talkative. I put down loquacious, argumentative. And one question we always ask in homeopathy, what was going on at the time you developed the event or vision loss? And he says, well, I lost an argument to my wife. Now, a traditional ophthalmologist would say, that has nothing to do with this central retinal artery occlusion, right? Nothing. But to the homeopathic doctor, that has everything to do. So I said to Dr. Dada, this is a serious condition, and I don't know if homeopathy will help you, but based on what I did, your findings, this is a homeopathic remedy. I gave him Bothrops. Bothrops is the viper remedy. It met all his findings. His findings, not only the physical, the mental, emotional, and his nature. Gave him the Bothrops. I says, take this. I know you're flying back to New Orleans, but give me a call in about a week and let me know what happened. So he called me on the phone in about a week. He says, perfect remedy, Dr. Kondrat, perfect. Vision is back to normal. And I was like shocked. And he says, Dr. Kondrat, you sound shocked. This is homeopathy. Homeopathy works. And that convinced me that homeopathy can produce miracles. And of course, he went to the retinal service there, and they said, well, it was misdiagnosed. You never had the central retinal artery occlusion. So the patients typically I see in my practice is they were told nothing can be done. They have a fear of surgery or injections. And they have a belief that there's a better way to treat disease. And of course, dry macular degeneration is a big problem. Typically, progressive visual loss, they take the ARIDS vitamin. This guy's afraid of losing his driver's license. Now, I know after the meeting, you're going to come up to me and say, what's a good homeopathic remedy for macular degeneration? There isn't one good remedy. If I treat 100 macular degeneration patients, each one will probably need a different homeopathic remedy because you're treating the person. You may have a person present with macular degeneration that is fearful of going blind. Maybe someone else it was related to grief. I often see a death of a loved one, maybe financial situations. I had a businessman who went bankrupt, and during my homeopathic case, he said, I was blindsided by my partner, and that gave me the remedy. The insult from his partner, the bankruptcy. And this is in the Homeopathic Materia Medica. There are hundreds of remedies that have been documented to treat macular degeneration. And then we look at these, we look at the mental emotional. Wet, I see a lot of patients with wet macular degeneration. This 92-year-old was getting an injection a month. Can you believe it? Since 2013, an injection every month for 7 years. And after one homeopathic remedy, I didn't cure his disease, but he felt his vision is much better, objects are clear, and his last exam, the doctor says you no longer need any injections. Now, when I do a consult, I never tell the patient, you don't need to see your ophthalmologist. I said, you need to continue care. This is adjunctive therapy, and I'm trying to emphasize to you that this is something that can help our patients while you're doing traditional. And this is an example of different remedies, bleeding in the eye. Glaucoma, I think, is a big, big condition that can help. So many of our patients are taking 3 or 4 eye drops. They're having side effects. They're not getting better. And this is one case I'm just going to briefly mention here, progressive glaucoma. After homeopathic remedy, she's less stressed. She's feeling better. And the doctor, instead of talking to her about surgery, he reduced her medication. So the homeopathic evaluation want to know how their vision problem is affecting them. How does it affect their life? When did it begin? Other associated changes in their health and other modalities. Are they warm? Are they cold? Are they thirsty, thirstless? How they sleep? What makes them happy, what makes them sad. So the homeopathic evaluation is very interesting, and it can be done in a short period of time, and it's not deep psychotherapy. You just want to get to know the person. And I love it when a patient takes the remedy and goes, Dr. Kondrat, I have never felt better about myself. I love it when they say that to me. Now, just recently, I took my homeopathic remedy. That was close to 30 years ago for my asthma, but recently my blood pressure is starting to get up. I don't like taking medication, and also I'm having a real problem urinating, 2-3 times a night. And so I sat down, went through my homeopathic Materia Medica, found a remedy that I think fits me. I took the remedy, my blood pressure has dropped, and now I'm not, maybe I'll get up once a night urinating. And like my mental, emotional state, I think it has improved. You have to ask my wife. Now, there are many, many publications demonstrating the validity of homeopathy. This is one, the treatment of acute childhood diarrhea, which is the lead article in pediatrics. Randomized study that showed that the homeopathic group had a statistically significant decrease in the duration of diarrhea. Benavisti study, which looked at dilute antiserum IgE and affected the degranulation of basophils. Another article here, I'm going to go through these quickly, I don't want to bore you. So anyway, in conclusion, expect miracles with homeopathy. And there's a long history of homeopathy in ophthalmology, and to me, I think it's a perfect match with Christians, homeopathy. And it brings spiritual healing into your practice in a different way. So what I'm proposing is that I'd like to begin a study group. Those of you that might be interested, my email address is down below. Email me, and we could maybe have a monthly study group. And also, I think one of the best ways is case presentations. You have a problem patient, they may be open-minded to homeopathy. Hey, I'll take the case, we can do it on Zoom. I'll tell you why I selected the homeopathic remedy. We can also talk about homeopathic philosophy, materia medica, case taking. I am in the process of writing a book called Homeopathic Ophthalmology, an eye surgeon's discovery of a 225-year-old secret to reversing vision loss. Now, I was supposed to talk about transition to a humanitarian surgeon, but I had to get that in about homeopathy because that's a passion of mine. I had a 20-year hiatus where I did not touch a surgical instrument. I was busy doing homeopathy, and I thought I was a pretty good surgeon 20 years ago. And my wife said, honey, let's go. There's an organization called Vets with a Mission. It's a Christian organization where they take Vietnam vets who were traumatized back to Vietnam to do mission work and to help them heal. And they needed an ophthalmologist to go to do eye exams, so I volunteered. A very moving moment. There's a clinic in Vietnam that was built, what is his name? I can't see it. Anyway, his helicopter was shot down, and they built a memorial clinic. And during my examination in that clinic, I examined an elderly Vietnamese man, and as it turned out, as a young man, he was the one that shot his helicopter down. So you can imagine the healing that took place with these vets. He was a young guy, and he was just told this is the enemy. So I had a wonderful experience in Vietnam, but something happened. There was a guy here with a sixth nerve palsy, and in Vietnam, if you have esotropia, cross eyes, you're considered possessed by the devil. This is kind of like he was shunned, and he went everywhere. Saigon went all over, and everyone said nothing can be done. And I said, my goodness, he needs an R&R. And in my practice, I did a lot of muscle surgery. I felt very comfortable, but my goodness, it was 20 years. So I said a prayer, they suited me up, and little did I know that the instrumentation wasn't that great. I can remember I wanted cautery. They shut off the air conditioner, they got a Bunsen burner, they heated up a speculum, and that was my cautery. Anyway, the case was very successful, and I said, these countries really need help. That's when I then got my certification, C International. And I think mentorship is really important. I want to thank especially Jeff Rutgard. Is Jeff here? He was the one that taught me my first MSICS course. And he kind of held my hand during my first couple of missions. And we also did some MSIC training together. He's just a great teacher, great guy. And I also want to thank Glenn Strauss. Glenn's not here. And I can remember the first time I applied to work on the Mercy ship, my application was denied. Glenn felt I didn't have enough experience. So after I did about 1,000 M6 cases, I sent Glenn a video, and I thought Glenn was going to tell me, oh, Dr. Kondrat, you're super, you're doing such a good job. He sent me 2 typewritten pages on ways I can improve my M6 technique. But anyway, make a long story short, I'm now the senior ophthalmic consultant on the Mercy ship. And so that's been an honor. I've done many missions over the years. Pre-COVID, my wife and I were doing 2 missions a month. Russ Montgomery, on the left there, is an amazing minister. He's doing such great work in Haiti, Cuba, and Angola. In fact, he needs a surgeon for a trip in Angola in September. If anybody's available, please contact Russ. He's a great guy. Now, I was supposed to give some MSICS pearls. Do we have video 5 up? This is my 16-year-old niece, and she came with us. She wasn't sure what she wanted to do with her life, and she came with us on a mission to Haiti. And part of her senior project in high school, she had to do a presentation. So she did a presentation on how to do MSICS. So make sure you have your notepads ready. Take some notes, and she's going to explain to you how to do MSICS. Oh, no, that's not it. Video 5.
Hello, welcome to my demo. In this video, I'll be showing you how to do an extracapsular cataract extraction. The first thing to do is prep the patient, and what I'm doing here is using betadine solution drops to clean out the eye. Now I'm going to take that same solution and use gauze to clean out the area that surrounds the eye. What I'm doing here is using inwards to outwards circular motions to get rid of any dirt. And you're going to do this 3 times, so you want to soak the gauze 3 times and clean out the area around the eye 3 times. When it's your 4th time, you're just going to take gauze and dry the area off. What I'm doing here is injecting a nerve block of 50% lidocaine and 50% bupivacaine, and the purpose of this is so that the patient feels numb and no pain. Next, we are going to take a diamond steel blade in order to make an incision into the cornea. The incision has to be large enough for the lens core to be removed in one piece. I am now using a push-pull to help remove the diseased lens. This diseased lens is called a cataract. What a cataract basically is that it's when the lens becomes cloudy, so then your vision becomes cloudy as well. Usually in this process you're going to have saline flow in and out. However, I don't have an awesome assistant, unfortunately. Now that the cataract has been removed, we can implant an IOL. This is an intraocular lens, which is an artificial lens that focuses light onto the back of the eye, which improves vision. And to close the incision, we are going to use sutures. Eventually, these stitches will dissolve.
You taking notes, Jeff? But now she wants to be an eye surgeon just like Uncle Ed. She has a direction in her life, which is wonderful.
Now we are going to inject the final injection, which is the Vigamox mix, and this is an intracameral injection, which means it is an antibiotic. The purpose of this is to keep the eye from getting inflamed or infected, which would negate the entire surgical process, because if it does get infected, there is chance of loss of vision as well as loss of the eyeball. To finish off, we are going to use an ophthalmic gel. And now we are going to take an eye shield with gauze and cover the eyeball so that the patient does not touch the eye. And she got first place in her high school presentation. And now we're done. I also wanted to just insert a clip from my Haiti trip to show that I actually have prepped a patient in real life, and I've done some of these things in real life. Usually the surgery actually only takes about 20 minutes, so you can get through a lot of cases in one day. And so here I am. This is the part where I was talking about cleaning the eye with the betadine solution. And I just thought it would be a nice little clip to insert. So yeah, Thanks for watching.
Okay, these are my 4 MSICS tips. Number 1, how many of you ski? You got to keep your tips up. You keep your tips down, you're going to get into trouble. By keeping your tips up as you're going into the cornea, make sure you keep them up. The tendency is you're thinking you want to go straight into the cornea to make it easier to get that lens on. No, no, you want to go up, up, up. Deep in the dome will get you home. I think early mistakes are not going very far in that corneal dome. Large to be in charge. You know, we're doing phaco incisions and you're just so used to doing that 5mm capsulotomy, and you know, all your training is to keep that nucleus in the back. When you're doing MSICS, you want to do a large capsulotomy to get that nucleus out. And Uday Degvin, his famous quote is, "Spin and you will win." He's a cataract coach. I don't know if you're familiar with him. And he talks about spin if you win. You want to really make sure that nucleus is free. You're able to spin it, you're going to have much better success. So those are my 4 MSICS tips. And this is a short video of many of our missions that we did pre. Lastly, I want to close. I hope some of you may be interested in investigating homeopathy. And email me if you're interested. We can maybe start a study group. So I want to thank you so much for your attention. It was a real pleasure speaking to you.
Can you turn this? Oh. A reminder to board members, we've got a 4 o'clock meeting today. Thank you so much, Ed. Appreciate you. Any questions? Thank you.
All right, you're all excused. We'll see you tonight at the banquet.